Hi everyone, it's Dr. Tidman. Thanks for stopping by my channel. This is part 4 of a 5-part series on Caregiving 101. This one's entitled, So They're Home. Now what? Believe me, this series is something that I have lived. I really wanted to produce this series because I felt that families are not given a lot of information or help, and patients don't know what to expect and what they should do. And so, based on my 2 books, I decided to create this series. The links to my 2 books will be posted in the description. So, they're home now. They're home from the hospital. They're home from rehab. What do we do now? I'll review a little bit of how to communicate with home health care services and what is involved in home health care, some of the terminology they'll use, and then, of course, my tips and takeaways. I always try to give you all some practical stuff to live with. So the first thing to really keep in mind is, how accessible is this home? I can't tell you how many patients I've worked with that were now going to be living in a wheelchair, and they lived in a tri-level. So you walk in on a landing and you have to go up a flight of stairs or down a flight of stairs. Well, unless you get a stair lift, that's not going to work very well. So be kind of knowledgeable about the home environment. Get an idea of what kind of home mobility equipment they're going to need. Is it a walker? Is it a wheelchair? Is it just a cane? Get an idea of what home bathroom equipment they're going to need. I can tell you that most people who've had an illness or an injury who are over the age of 65 will probably need some kind of shower chair or toilet riser, bars near the shower and the toilet to help them get up and down. These are things you need to start thinking about even when they're in the hospital. Some of this stuff takes a while to line up contractors to put them in. Now let me tell you that you can get grab bars at Home Depot and Lowe's. So you don't have to go to some expensive medical equipment company. These home improvement stores are now carrying a variety of grab bars. Now, the issue is you need somebody who's knowledgeable about how to put them in, because they have to go into the studs to be firm. So it's easier to find someone who can at least install them if you go and purchase them. Also, there's all kind of home bathroom equipment available at a local Walgreens. They carry a lot of stuff. Walmart does. So check into some of these places and see if you can obtain whatever home bathroom equipment that they might need. The OT in the facility where they're receiving their therapy should be telling you all the equipment that they need. If they don't tell you, you need to ask them to prescribe what equipment they might need. Home exercise equipment. Well, if your family member really needs to work on his or her lower extremity strength, there are all kinds of little devices that you can get to help them do that. Ask your physical therapist at the facility to prescribe some home exercise equipment. And then, of course, there's home health. When they were moved from rehab, the social workers should have set up your home health, or at least given you the numbers of the home health agency covered by your insurance. Don't wait for them. You need to contact the home health agency before your family member is discharged, because many of them have long waits to get started. So, another thing on your list is you need to ask the social worker for the name and contact information for the home health agency that's on your plan. And then contact this agency and get things set up. Typically in home health, you can be offered some therapy services. Not always, but sometimes you can. But keep in mind, if you're thinking that your family member is going to receive physical therapy every day once they go home, that is not what home health care does. It is not rehab. What it is a couple of times a week, a physical therapist comes to the home and works on prescribing a home exercise program. That is their goal. Their goal is not rehab. Their goal is to prescribe a home exercise program. These numbers of visits are limited according to your insurance coverage, so you need to know what your insurance covers. Physical therapists will evaluate for mobility, a home exercise program, any equipment they're going to need. But one of their goals is to connect you, the family and the patient, to an outpatient physical therapy agency. Home health care is very short term, y'all. It is not on and on for weeks and weeks and weeks. It may be only 2 weeks. You might be able to scrounge out 3 weeks, but it is rare to find home health agencies that will continue for 4 weeks. It's the same with occupational therapy. These are just a few of the things the occupational therapy needs to evaluate you for. Again, their goal is to evaluate you and set up a home program for you, and then connect you to an outpatient facility. They work with you typically on toileting, showering and bathing, dressing, grooming, meal preparation, even grocery shopping or community mobility, some safety, pet care, access to transportation. These are just a few of the things that your occupational therapist should evaluate you for. And then they'll connect you to an outpatient program. It is the same with speech therapy. They're going to evaluate your cognition and communication, chewing and swallowing, your memory, augmentative communication devices if you need one, use of apps or scheduling reminders, and they're going to connect you with an outpatient program if you need one. Nursing services. Nursing services aren't always involved in your home health, but if you need assistance with medication management, wound care is a big one that they do. They help you get appointments with follow-up providers. If you go home on IV antibiotics, they take care of setting those up and doing those infusions. They evaluate the home setting and refer you to other services in the community. They supervise the home health aides that I'll talk about in a minute. They coordinate the therapist assignments, and then they receive and review those therapists' evaluations. So what does a CNA or tech do in a home health setting? If nursing feels you need it, and if you do need it, you should push for this, they come and do bathing assistance twice a week, dressing assistance, grooming assistance. They communicate with OT about what ADL equipment, activities of daily living equipment that you need, mobility assistance. They communicate with PT about any equipment that you need for mobility, medication assistance, and they communicate with nursing about the needs in medication or changes that are needed. Things to remember. Home health services are not rehab. They're limited up to 4 weeks according to your coverage. I can tell you I've rarely seen them continue for 4 weeks. Typically it's about 2 or 3. PT, OT, and speech therapy, typically 1 to 2 times per week. It's not daily rehab. They provide CNAs for bathing assistance if the therapist and nursing feel that that's important. But typically the CNAs only come a couple times a week for bathing assistance. Home health care is short term. I can't emphasize this enough. And their ultimate goal is to transfer you to an outpatient agency for your continued rehab. Now, caregiver services, these are different. These are not home health care. These are paid out of pocket, and there are agencies. One example is Home Instead, is an agency who employ non-medical caregivers. You can set this up if you have the financial resources to take over after home health care is complete, if your family member needs continued help at home. These are some approximate typical costs involved in these kinds of agencies, and of course every agency is going to be different. But to get a nurse, an RN, it's about $40 to $60 an hour. Can be up to $75 an hour if nursing is actually needed, which is not often the case. CNAs can be assigned, but their costs are typically $20 to $25 an hour. A non-medical caregiver would be more like a companion to come in and do some light cooking, some light housekeeping, just to be there. It can run between $15 and $20 an hour. These services are typically not covered by any insurance. Some long-term care policies may cover them, but typically most insurances do not cover these services. These are self-pay, out-of-pocket costs. What about durable medical equipment? This really depends on what your insurance covers. Equipment can be either purchased or rented. If you're going to need a hospital bed, you can rent one. It really depends on your coverage. Certain DME agencies are on your plan, so you can't go to any DME agency out there and expect them to be covered. Now, keep in mind that Medicare will only pay for one mobility device. If it's a walker that's recommended, they'll pay for the walker. If it's a wheelchair that's recommended, they'll pay for the wheelchair, but they will not pay for both. Now, wheelchairs are more expensive than walkers, so I would recommend you ask Medicare to pay for the wheelchair. And then you go and find a walker. You can find walkers even at some of these thrift stores. You can find some lending closets in some cities have equipment you can check out. You can ask around at your church or community center. Maybe somebody has a walker in the closet they would loan you. So remember, for the more expensive equipment, have your insurance pay for it, like a wheelchair. Now, DME providers also provide respiratory therapy and home respiratory supplies. That's oxygen, cannulas, CPAP supplies. So, if your loved one is needing these, a DME provider is who you need to contact that's on your plan. And remember that only Medicare Part B covers equipment like this. So if you don't have Medicare Part B that you pay for every month, or you don't have a Medicare supplement, you only have Part A, and Part A does not pay for any of this. Many people don't know that until they get in this situation. So, final tips and takeaways should sound pretty familiar. Coordinate home health referral with a discharging facility, either the skilled rehab or acute rehab, before you go home. This has to be set up before you're discharged, believe me. Be informed of your insurance coverage, your Medicare coverage, and what your self-pay amounts are going to be. It's terrible to be going through all this and then all of a sudden you have all these bills coming in. Coordinate home health through the agency liaison that should have shown up at your rehab center before you discharged. The evaluating nurse from the home health agency and the home health therapists. You need to be coordinating with each of those people. Have a plan for when home health ends. Know the outpatient facility where you're being referred. Get the equipment you need. Get it while home health is there, and they can help you with what you need and help you train on what you got. And then connect with community support or caregiver services. If you have the financial resources, maybe hire a caregiving agency short term to just help you get some things in place for your family member. Thank you so much for stopping by and viewing Caregiving 101 Part 4. The final part in this series will be posted next Monday. I'll also post links to my 2 books, which have a lot of this information in them. Thank you again. Remember to subscribe to my channel and hit the notifications so you'll be informed about my future videos. Take care, everyone.